Good afternoon, ladies and gentlemen. It's a great honor for me to be here today. I'm Dr. Byung from Tokyo in Japan. I'm Korean, but work in Japan now. Let me introduce myself. I have double medical license in Korea and Japan. Most popular procedure that I do in my clinic are filler, Botox, and skin booster, and thread lifting. I use more than 15,000 cc of filler every year since 2010. I have been a keynote doctor not only with a HA filler such as Restylane, Juvederm, and Perfecta, but also PCL filler, hydroxyapatite filler, Dextran filler, PCL filler. And I also have been a keynote doctor thread lifting called MINS and do the Korean botulinum toxin, Nabota, and Veganus. I started to use Gori 1 year ago, and I do the procedure over than 300 ml every month. First of all, I'd like to tell you why I use Gori. To put it simply, Gori is an injection what has a thermogenetic effect which is monopolar RF. It is PCL solution, which is not particle material, like Alan said, what is PCL filler. As you know, PCL filler has volumizing effects on injected area and stimulated collagen synthesis, so more volume on the injected site only. It doesn't spread out from injected site, but Gori is not particle material, so it spread evenly from injected place like cell line and stimulate collagen synthesis throughout the whole face and minimum cannula lines. There are some solutions to rejuvenate the skin and fight this aging process to treat the volume loss. One of my favorite solutions is filler injection. In these days, collagen stimulator is another modality from volume augmentation, such as Sculptra or Juvederm. To treat descent, we can use thread lifting and HIFU for deep layer sagging, and RF like Thermazy for skin tightening and lifting, which are effective but painful. Surgical treatment is also an effective option, but it is invasive and has long downtime. Like Thermazy, Gori stimulates collagen synthesis and gives a lifting effect and improved elasticity. In addition, Gori leads to skin improvements with whitening and moisturizing effects. This case is 40-year-old Japanese woman who has had atopic dermatitis from childhood. This case shows improvement of skin tone and elasticity. She injected 4 cc of Gori into her whole face. Left side is before and the right side is 1 month later. Right side looks more young and shiny. She's in remission with her atopy. Her face is lifted and looks moisturized. Her skin used to be reddish and dry because of atopy, but it is improved a lot with Gori. This case is 67-year-old woman who didn't want to inject foreign body material like HA filler, so I recommended 4 cc of Gori. In this case, we can see the patient's skin got brightened and even toned. Melasma is much improved. She had a moderate degree of melasma, but it is much improved since she got this treatment. Her face showed lifting effects as well, especially on her mid-face and low face, such as Indian band and nasolabial fold and Marionette lines. This case is 62-year-old woman. She had complaints about mid-face and low face sagginess. She didn't want to get an invasive treatment such as thread lifting. So I recommended 4 cc of Gori treatment. How do you think? It's not a thread lifting. Her face now looks naturally younger and balanced. The patient's face is pretty lifted up and tightened. So her Indian band and natural beer fold are much improved. She just got 4 cc of Gori treatment one time, just one time. But the result of facial sagging improvements can be compared to result of thread lifting and last over than 6 months. This case is a 64-year-old woman who had a stress looked old. She wanted procedure without downtime because of her working. So I also treated with 4 cc of Gori. This case is not a thread lifting case as well. The patient's face is not only lifted up, but also got a very nice glossy look. From this perspective, we can see the patient's meridian line much improved as well. Who is this? It's me. I considered low blepharoplasty, but I have gone through 2 cc of Gori treatments performed 8 months ago, like here, injected here, 3 lines. And my under eyes much improved, so I don't think need a surgery anymore. And my skin got brighter from this procedure as well. I'm still so happy. This case is 47-year-old woman. She got 4 cc of Gori and 1 cc of filler at lips, and then her faces looked younger and smaller than before. How do you feel this case? Her sagging is much improved like a thread lifting, and I feel like she went back 10 years throughout time machine. Gori spread all over the face and stimulate collagen synthesis, resulting in lifting and tightening. It's not volumizing effect. It's shrinkage, latest shrinkage of the face and lifted up. This case is 67-year-old woman who has gone through surgical facial lifting, resulting in uneven skin surface along the facial contour line. This uneven skin can be served with Gori as well. Her sagging is much improved, and her face is very even. And then from now on, I'd like to tell you about my experience. I usually use Gori with cannula technique from some entry points. First entry point is about 2 to 2.5 from the lateral contus, 2 centimeter, 45-degree points, and then inject with the cannula. I inject solution linearly, 1, 2, 3. So the solution is spread out evenly all over the face. And second point is the cross points of the hairline and zygomatic arch, and then I inject into the temple. And third point is 1 centimeter apart from the mandibular angle along the mandibular border. So I inject along the mandibular border. Sometimes I use needle technique. I use 34 gauge, 4 millimeter length of needle into the skin, into the subcutaneous layer. This is a real case. I show you. I make a hole the 2 centimeter apart from the lateral contus, 45 degree, and use the 25 gauge, 5 centimeter length of the cannula, and inject it into the subcutaneous layer. First line is under eyes. I usually use 0.5 cc of Gori under eyes. Under eyes. And then second line is heading to in the middle of nasolabial fold. I injected the subcutaneous layer. You can see the sound of when you inject into the subcutaneous layer. And third line is heading to the nasolabial in the middle of nasolabial fold. And then for the temple, I make a hole across points of the zygomatic arch and hairline and into the subcutaneous layer. I injected 0.5 complex solution and then make a third point 1 centimeter apart from the mandibular angle and along the mandibular line. I injected into the subcutaneous layer 0.5 of the complex solution. I mixed 1% lidocaine 0.5 cc and normal cell line 1.5 cc. So I make the Gori 2 cc mixed complex solution. So I can do painless procedure and reduce the risk of bruise. I inject amount of the injection forehead and from forehead neck is follow this. And then the possible side effects. The first side effect is temporary edema. Temporary edema is served with the natural procedure, but if you want to shorten the edema time, I usually subscribe prednisolone and antihistamine for 2 to 3 days. To prevent bruise, I usually use 25 gauge cannula with 5 centimeter length. And when I use needle, I use micro needle, 33 gauge or 34 gauge of 4 millimeter. Under 1%, it can possible occur the allergic reaction can be occurred, but it is served naturally. But if you shorten the natural time, I usually use the prescription steroid and antihistamine for 2 to 3 days. And then I'd like to tell you about the combination treatments. When I inject Gori procedure, I combine it with sometimes botulinum toxin for the lifting effects, like this figure. I inject the skin layer to lift up, and sometimes I use the master muscle botulinum toxin at the master muscle. Sometimes I inject hyaluronic acid combination. The purple shows the increase of the fat, and the green shows a decrease of the fat layer with the aging process. So if you inject the filler injection, the green area, you can get the lifting effect. This is the combination case. I injected 12 cc of hyaluronic acid into the temple, lower cheek, chin, and nasolabial fold, and 2 cc of Restylane at the nose and lips. And then I inject Gori, just 2 cc, the middle face and low face. The left side is before, this is right after, this is 2 weeks later picture. You can see the lifting effects and under eyes improvements. Gori can lead to the lifting effects. So I didn't inject filler on her Indian band, but her middle face is lifted up. So naturally, the apple cheek. You can see her natural apple cheek. It's a result of the Gowri effect, lifting effect. Under eyes is improved. You can see the results. Like this. Her face is brightened and shining. Yeah. Thank you for paying attention to me. Thank you.